So that should be pretty much everyone logged on now, so I'll just pass you over to Ellen.
Thank you, Becky. So welcome to this Living Well with Myeloma session on keeping active when you have myeloma. And as Becky said, I'm happy to try and answer any questions at the end of this session, so please do send them in. Some research has certainly identified that physical activity declines after patients are diagnosed with myeloma, with fatigue, bone damage and pain identified as the main barriers to taking part. I'll discuss a little bit more about the main barriers later on in this session. But we do know that patients are often willing to try an exercise programme if one was offered to them. So regular exercise is an important part of a healthy lifestyle, and in this webinar we will explore what the benefits may be for myeloma patients. I also want to look at keeping active after a stem cell transplant and ways of returning to previous fitness, as well as what types of exercise are best and worst, and looking at some of the safety aspects as well. So firstly, looking at some of the barriers to keeping active. Myeloma can cause bone damage, pain and fatigue, and this can make patients very anxious at the thought of doing any exercise. So this is a perfectly natural reaction, but it's certainly possible for you to be able to keep up a certain level of activity. You needn't rush into doing anything too strenuous, and the type and level of exercise will of course depend on the extent of any bone damage caused by the myeloma, your level of fitness in general, where you are in your treatment pathway, and that will also have a part to play in keeping active. And of course those just out of stem cell transplant, for instance, will feel quite fatigued for some time. I'm going to look at activity post stem cell transplant a little later in this presentation. For those diagnosed with or who develop bone issues, it may be necessary to avoid some exercises or to hold off doing anything until your doctor is happy that it's safe to begin an exercise regime. I'll be looking at some exercises which are not recommended for those with bone damage later on, but it may be possible to do something, and it may be an idea to seek advice from a physio. Your doctor can refer you to a physiotherapist if that's appropriate. So we know that fatigue can have a hugely negative effect on motivation, but it's worth bearing in mind that regular gentle exercise can in fact improve fatigue. So if you find you're having to force yourself to get out and do something, you may notice that this becomes easier as time goes on. Anxiety can also stop you doing things too. You may worry that you're doing yourself harm, that you're risking further damage, or that you're leaving yourself open to picking up infections. Again, these are all very rational concerns, and there is often something you can do, and gradually building up your stamina will give you a much needed boost and make you feel better all round. Of course, the worry about infection is a real one, and there will be times when your susceptibility to infection is increased. If you are told that your immune system is particularly low, either due to the myeloma or to its treatment, then you would be advised not to go swimming, for instance, or to avoid busy, crowded places. But a gentle walk in the countryside away from crowds might be perfectly acceptable. Looking now at some of the benefits of keeping active. We know that regular gentle exercise as part of an overall healthy lifestyle provides physical and psychological benefit, and most healthcare professionals will recommend some form of exercise. Overall exercise can help reduce fatigue, as we've said, and the fatigue we know is an issue for many patients. Regular gentle exercise can also improve general fitness, strength and stamina, as well as boosting feelings of mental well-being. When we exercise, endorphins are released, and those can reduce stress and anxiety. So keeping active with regular exercise also helps keep the joints mobile, improving flexibility, and this keeps muscles toned as well. Toned muscles do help to support our bones. And loss of muscle tone can cause weakness, unsteadiness, and loss of confidence in walking. Many patients tell us that their confidence takes a bit of a knock following diagnosis anyway, and some may even lose confidence a bit in their walking and mobility generally, especially if their legs have been affected either by the myeloma bone disease or some of the treatments for myeloma. Steroids, for instance, can cause loss of muscle mass, especially of the bigger muscles of the thighs, and that can certainly take its toll. So keeping active can help build confidence, improve quality of life, and this in turn can help in coping day to day with all that myeloma brings. More about coping now on the next slide. So it's important, if you can continue enjoying what's important in your life. That may be hobbies such as gardening, exercise classes, joining in family activities, walking with friends, or activities that were perhaps important to you before the diagnosis. Some people worry that once myeloma is diagnosed, then that's the end of any physical activities, but that's not the case. With some common sense and with the OK from your haematologist, it's certainly possible to continue with certain activities or even to explore new ones. These activities can help you cope day to day with the challenges that living with myeloma brings and improve your feelings of well-being, relieving stress and anxiety, and keeping the enjoyment in life. So looking specifically at keeping active after a stem cell transplant, I wanted to spend a little time on this topic specifically, as I know from calls to the Myeloma Infoline that this is something that concerns many of you. After being discharged home from your stem cell transplant, your doctor or nurse specialist will give you advice which will likely include taking regular exercise. We know that it's often beneficial psychologically to have some attainable goals and something to look forward to in the days and weeks following a stem cell transplant. The timing of this can vary from person to person, but it's usually between 2 to 6 months when you feel that you are back to some level of normality and can really start building up your strength again. You have your energy back and you feel motivated to get yourself as fit as you can. Please don't worry if it takes a little bit longer than this. We know that everyone is different. It's really important not to overdo it, however. Many patients are so keen to get back to normal that they tend to rush into doing everything they did before the transplant. But please remember, you've just been through a pretty major procedure, have spent some weeks in hospital with little or no activity, and you can't expect your body to feel the way it did immediately. These things do take time, I'm afraid. It may even feel for the first 3 or 4 weeks that you're going 2 steps forward and 3 steps back. So do allow yourself to have the odd off day. It can only increase frustration and anxiety if you push yourself too hard and fail. Make your goals achievable, build your strength and confidence gradually. There's often no good reason why you shouldn't be able to get back to your hobbies and activities post-transplant, but achieving this can be a gradual process. So exercise should be regular, mostly gentle, and should build up gradually. So here are some of the best examples. So especially if you haven't been used to or taking regular exercise or haven't done it for a while or are recovering from treatment or have bone damage. Of course, we are all different and everyone will have different fitness levels anyway, but generally speaking, exercise should be balanced. That means using muscle groups equally and not load bearing. Lifting heavy weights can put stress on the back where there might be some underlying damage caused by the myeloma. Tai Chi and yoga build strength and improve balance, which in turn can help prevent falls and increase confidence. Walking can be started off gradually and built up. If you're recovering from treatment or surgery, start by walking around the garden or down to the local shops and plan to increase the distance week on week. Again, those achievable goals will make you feel as if you are progressing. Cycling is a good form of exercise, it gets you out in the fresh air, but of course you can start off and build up by using static bikes. You even get these small pedals which you can use whilst you're sitting in the chair. I believe some transplant units have these available for you as well when you're recovering from your transplant. But if you're doing that, if you're sitting in the chair using these pedals, please make sure that your back's quite well supported. And of course, at all times, listen to your body and stop if you feel any pain or are unwell. So on to what might be considered the worst. As I've said previously, the type of activity you do may depend on the extent of any bone damage caused by the myeloma, and some activity can potentially make things worse. I know that some myeloma patients are super fit, have little or no bone damage and take part in some amazing activities, triathlons, endurance cycles and marathons for instance. But if you do decide to take a new exercise programme or increase any activity, please do speak to your doctor first. Your haematologist might suggest you run things past a physiotherapist in the first instance to get some tips about what you can and can't do. Some physios will even have exercise programmes specifically tailored for you. So unbalanced exercises can jar muscles and bones. Sudden twisting, for instance, may not be the best thing for you. If, for example, myelomas cause damage to your spine, then you may wish to speak to your haematologist before taking up golf or tennis again. These are quite unbalanced and there's a lot of twisting involved. Sudden bursts of exercise should really be avoided, and any activity should start off slowly and be increased gradually, especially if you're doing something new. Please stop any exercise and speak to your doctor or nurse if you feel unwell, if you have any pain, or if you feel short of breath. So keeping active is very important, has many benefits, and it's certainly possible to think about resuming previous activities or to start new ones. And of course, Myeloma UK has some resources which may help. Of course, these don't replace speaking to your doctor or asking for a referral to a physio, but we do have a range of resources on all aspects of myeloma and its treatment. Our website has a discussion forum where you can chat to others and share experiences. And you can also view and download all of our publications, or we can send them out to you if you would prefer. Here are some publications which offer suggestions around keeping active and living well with myeloma. Please do let us know if we can send any of these out to you.
Okay, thanks very much, Ellen. Yes, we'll be sending out links to all these resources as well at the end of the webinar, where we've also got the session recording and available for viewing. So we hope you found that helpful today. So just while we're waiting for the questions to come up. Okay, so our first question comes from Thomas. He says, I sometimes get sore shins when jogging, but my doctors don't think there's any bone damage in my legs. Would that be because my bones are weak?
Well, that depends, Thomas. Is this new? If this is new pain, it should certainly be reported. I mean, people who, in the general public who go out jogging can sometimes get pain in their shins anyway. But yes, certainly myeloma patients who may have some weak bones might be more susceptible to pain. And I think that any new or increasing pain should be reported and should be investigated. And again, this is why it's really important to start off slowly. So don't go straight into rushing off doing a 5k jog. Maybe just take things a bit easy. Look out for things as well, like any swelling or redness, if you've got pain in those areas. There is something called shin splints that runners get quite regularly if they're overdoing it. So there are a couple of things to talk about. Absolutely, you should be discussing it with your doctor, who may well want to suggest that you take maybe a step back and start off a bit slower. But keep a wee eye on things, keep a bit of a diary, notice if it's getting worse, and do let your doctor know. If it is extremely sore, then your doctor may want to x-ray you just to say that there's no new damage occurring there. And again, it also depends really if you had any bone damage to begin with when you were first diagnosed with myeloma. Myeloma bone damage it can affect anywhere in the body, as you know, but it does tend to affect the bigger bones and the bones of the rib cage. So the ones in the shins, it could be a referred pain from somewhere else. I do think it's a good idea to be quite vigilant about it, Thomas, but it may or it may not be related to your myeloma.
Thanks, Ellen. Thomas, if you've got any more information on your bone damage, whether or not this is new pain or if you had it before, feel free to get in touch on the info line and we'll try and discuss things a bit further. But yeah, we can see what we do there as well. So we'll look for our next question now. This comes from Diane. She says, swimming seems like a good choice for myeloma patients, but I'm concerned about illness from the pool. Can I take anything in advance to stop getting ill?
So swimming is excellent exercise. It's balanced, it's regular, it's gentle, it uses all your muscles groups, it builds your stamina. It's an excellent form of exercise. There will be times throughout your myeloma pathway where you are more susceptible to picking up infection. Newly diagnosed patients, for instance, patients who are relapsing, patients on treatment may well be what we call immunocompromised, and that means that their immune system isn't as strong as it should be. Your doctor or nurse specialist will be able to tell you just how your immune system's doing. What they look at is a type of white blood cell called a neutrophil. And if your white blood count is within normal levels, your neutrophils are normal, then your immune system is as good as anybody else's and is probably as good as it's going to be. So if you're in remission or plateau, your myeloma is stable and your blood counts are good, then absolutely fine. If your nurse specialist or doctor says that your immune system's a bit weaker than it should be, your neutrophils are a bit on the low side, then perhaps it is an idea to avoid swimming pools. They are a bit, the changing rooms, and I don't know about the pool itself because it's got chlorine in it, of course. But they are areas where there's going to be a lot of people, children, and children are little bug factories, aren't they? So they're always sneezing and coughing all over the place. So if your immune system is on the low side, it might be a good idea to avoid them. But otherwise, generally, swimming is an excellent choice. Maybe try going to the pool in the quieter times of the day when all the schools are in, and that might be an option for you if you enjoy swimming.
Yeah, swimming is something that's been brought up a few times with patients in the past on webinars. And, in terms of the swimming pools, obviously, there could be areas that do have maybe some germs kicking about. Is there any difference between, if you're happen to be on holiday and you're swimming in the open sea or a swimming pool? Is there any option there that would be better?
I don't think there's much in it really. I mean, being on holiday, being in the sunshine on a Greek island certainly sounds preferable to your local swimming pool for sure, and all of the benefits that having a nice holiday brings as well, and swimming in the sea is an excellent form of exercise. Again, if you're on holiday, the chances are that your myeloma's pretty stable, your immune system's good, so you'll be in a good place really. So you're starting off from a good point. I think it's your immune system that's probably the most important point here for both of those options. I don't think there's one any better than another, and if you're not on holiday, then going to your pool regularly is an excellent form of exercise.
Okay, thanks very much for that, Ellen. If we do have any questions about this, please get in touch. As I said, you can go to the questions tab on your GoToWebinar viewer window, or if you're on a smartphone or tablet, just look for the question mark icon and you can submit your questions there. Okay, this next one comes from Polly. She says, I like to go hill walking, but since my cell transplant, I get out of breath easily the higher I go. I'm not tired, I just can't breathe. Do I just have to put up with that and take it easy, or is there something that I can fix?
That's a good question, Pauline, and shortness of breath on exercise is something that I talk about probably every day on the helpline. Shortness of breath on exercise is often a symptom of anemia. So I wonder if you are anemic, and your doctor or nurse specialist will be able to tell you if you are anemic. And I think you just have to listen to your body, and if it is making you feel unwell, perhaps take a couple of steps back, tone it down a wee bit, have a word with your doctor. Often again, patients are susceptible to anemia, usually when the myeloma is active, so at diagnosis or relapse, or when they're on treatments that can affect the production of your healthy blood cells. And what they look at particularly to tell you if you're anemic or not is the hemoglobin. So the hemoglobin level will tell you if you're anemic or not. If it's a shortness of breath that is normal, I mean, when we all do vigorous exercise, we will puff and pant a bit, and that's perfectly normal. And as you do more of it, as you build up your tolerance, as you build up your stamina, that should improve. But if it's something that feels unnatural, that's not normal, I would maybe suggest, Pauline, that you have a wee word with your doctor or nurse specialist.
Okay, I hope that helps, Polly. As I said, you can submit your questions at any time, so just keep them coming in, and thank you for the ones we've had so far. Okay, so our next question comes from Julian. She says, I have never done much regular exercise, but myeloma has forced me to take more care of myself. I have really caught the bug and I love it now, but I worry that as I get older, I won't be able to do badminton or tennis. What can I do as I get older?
Well, if you're starting off from a good place, Julian, if you're pretty fit anyway, there's no reason why you can't continue to do the things you enjoy. Again, it's really important to listen to your body, and as we get older, time does take its toll on all of us, and we find that we can't do the things that we used to be able to. But if you're starting off from a good place, if you're fit and healthy, then there's no reason why you can't continue. I would suggest that if your haematologist has told you that you've got any damage to your bones caused by the myeloma, that you perhaps be a little bit more careful. As I said earlier, tennis and badminton are kind of twisting exercises where you're a bit unbalanced and you're using one group of muscles more than another. And if you do have bone damage, it might not be the best. But if you've not got any bone damage, the myeloma hasn't particularly caused that in you, then do keep it up. And be quite vigilant yourself in reporting anything. And as I said earlier, if there's any pain, just stop what you're doing. Get to your doctor and maybe rethink things. There are lots of other things you can do. And if you want to be quite competitive, absolutely. I speak to patients every day who are doing quite vigorous, quite strenuous exercises on a competitive basis. It's certainly possible, but it is really individual, and like everything to do with myeloma, it's very individual. So, I think you need to have a word with your doctor. But it's really good that you are looking after yourself and keeping fit. That's good news.
And when it comes to badminton or tennis, if you had to choose between them, would badminton or tennis be better, or is it really very individual?
I'm not sure actually. I think tennis is a wee bit more strenuous, a wee bit harder work, only because I think it's harder work. The balls are heavier, the shuttlecocks aren't as heavy as the balls, and you have to be a wee bit stronger perhaps to do tennis. I think badminton might be a wee bit more gentle, so yeah, maybe badminton is the better one out of those two.
Right, okay. If there's any particular activities you want to let us know about, once again, just submit in the questions section of your window and let us know, and we can sort of discuss those at length as well. Okay, so Nadia's got in touch on behalf of her dad. She says if confined to a bed post-transplant, what's going to be done from bed in terms of building up strength or stamina?
Yes, and unfortunately, again, like everything to do with myeloma, we are all different. Some people recover from the stem cell transplant really well, and they're not confined to bed, and day to day their stamina and their fitness improves. Some people take it a little bit harder and do need to spend longer times in bed, but that will improve gradually, Nadia. It will. And your dad's doctors and nurses will be monitoring the situation. And I would like to think that every day will perhaps be a little bit better than the day before. And if he can push himself a little bit, obviously I don't know your dad, I can't see him or his medical notes, so it's a bit difficult for me to comment, but generally speaking, if he can get up out of bed on a regular basis, walk around and gradually and slowly increase his physical exercise, then he'll notice that things will improve. And if he's in bed because of fatigue, then that will improve with the regular exercise as well, and it will improve as he recovers from the transplant. Whilst you're in bed, it's not a good idea to be confined to bed for lots of reasons. If you're in bed and immobile, you are kind of leaving yourself open to picking up infections like chest infections, blood clots as well. People who are immobile are more susceptible to developing blood clots. So if your dad is in bed, if he's sitting in a kind of upright position, well propped up on pillows, give his give his lung capacity room to breathe. That will help him. But you can do kind of foot exercises, moving one leg at a time, flexing and each leg one at a time. But probably the best thing is if he possibly can get up and have a wee walk around. And of course, here as well, we need to be looking at nourishment for your dad. So if he's on a good, healthy, well-balanced diet, that will also help give him some energy. So if he's not managing to eat or drink, maybe it's something that should be reported to the doctors, nurses, maybe a referral to a dietitian. He needs to have the correct nutritional intake to be able to have the energy to do things. And it often feels like a very slow process to begin with, I know, and some people just don't see the light at the end of the tunnel, but it will happen. Patients aren't suggested to go through with a stem cell transplant if the doctors didn't feel that they're able to cope with it. So one day at a time, I think, Nadia, but do report anything you're worried about. It's really important.
Nadia, I hope that helps. We've got a few hints and tips in our Hints and Tips booklet about life after a transplant. So let us know if you do want a copy of that or if you want any more information on things post-transplant. We'll be sending out a list of the resources in an email following this webinar. I think we've got time for a couple more questions today. It looks like we're probably going to be finishing a bit early, but we'll get through as many as we can. Okay, this one's from Lynn. She says, I have rheumatoid arthritis and here we go, hypogammaglobulinemia and smouldering myeloma. I am therefore worried about what exercise I can do. Is walking the only option?
Okay, Lynn, well, so you've obviously got some other health conditions there. Rheumatoid arthritis can make your joints quite painful, and that can make it difficult for you to be as mobile as you'd perhaps like to be. I don't know that walking is the only option. These bicycle machines are pretty good, and you can get these rowing machines. It might be an idea, and I know that some doctors can refer you to gyms to do certain exercise programs specifically for those with health conditions. For instance, I know that patients who've had heart attacks, their GP refer them to their local gym. They get in fairly cheap, and there's particular exercise regimes. So ask about that. It may be that you can go to the gym and go around the machines, the rowing machines, the cycling machines, the walking machines. Again, start off slow and gradually build up. So I think, no, walking isn't the only thing you can do. It's a good one. Walking certainly is really good exercise, but explore the other options as well. And maybe a referral to a physiotherapist, speak to your doctor, ask if it's an appropriate option for you. As I said, physiotherapists often have exercise programs specifically tailored for patients, so ask about that as well then.
Okay, so it kind of sounds like with a lot of these things, it's about being patient and just, testing out a few things gently. Is that right?
Yeah, absolutely. I mean, it is very frustrating when, for instance, if you've previously been a very fit and active person, to go through a transplant, for instance, or to be a bit unwell with the myeloma, or to have side effects of treatment. It's quite frustrating when your fitness takes a dip, having been a fit person previously. And it can set you back physically and psychologically as well. But day on day, week on week, things generally do improve. And if you're in a good place with your myeloma, if it's been brought under control by treatment, or if you're on treatment and you're not particularly having side effects, there is lots you can do to keep fit, to keep healthy. And please remember that diet plays a big role in that, and it's holistic really. It's a healthy lifestyle, diet, nutrition, exercise, psychological, emotional, good health. It's all very important.
Okay, thanks very much, Ellen. We'll go to our next question then. This comes from Andy. He says, I have 6 crushed vertebrae, used to be extremely fit before my diagnosis in 2012, such as running and cycling, as well as being a rock climber and a mountaineer. I really miss running and cycling, but I take it I should steer clear of those activities.
Again, Andy, perhaps your doctor would be the best person to ask this, because I can't see your medical notes or your x-rays or your scans. Crushed vertebra can leave you fairly disabled, yes. Often in myeloma, if it has caused quite severe bone damage, there is often some repairing of bones, some healing. Unfortunately, it's likely that your bones will never heal to their previous density, and you will always have a bit of a weak area there. But there's no reason why you can't slowly build things up. It's important to keep your muscles toned, particularly. As I said earlier, toned muscles do support your bones. So, giving up everything would be the worst thing to do, really. So gentle, regular exercise, keep those muscles well toned. I do know patients who have got back to their quite serious sporting and athletic hobbies. I do know there's a patient who's one of our peer members who was a bit of a rock climber and a hill walker, and he did all of this. And slowly but surely he got back to a level of that. He maybe didn't do it to the extent he did it before, but jogging, start off running slowly, see how you get on. Cycling is okay. I mean, the worry I guess with cycling is if you fall off the bike or if you have an accident on the bike. But cycling in and of itself is actually quite a good exercise. So maybe static cycling at the gym, or these pedals that you can get whilst you're sitting on your chair, and again slowly build it up. And again, I think, Andy, specifically here, it might be an idea to get professional advice from a physiotherapist. So do ask for a referral, and the physiotherapist will be able to access your scans, your notes, your x-rays, and just see what damage is there, and perhaps give some individual suggestions.
Okay, thanks very much for your question, Andy. I hope that helps. I think we've got one more question that we have time for today. This comes from Adrian. He says, can you recommend anything that does not load my lower back, which is damaged, and I'm very anxious about it? I do water aerobics once a week, but even this makes my back pain worse.
Okay, that's a good one. I mean, I guess, as I said before, you really don't want to be doing anything that makes your pain worse. And I suppose water aerobics is generally a really good form of exercise, but if it's making your back pain worse, I would maybe take a bit of a step back and think about doing something else. I know walking can make your back a little bit worse, and I suppose again it's about slowly and gradually building things up, and perhaps seeking advice from a physiotherapist. Our lower back is an area that is often where we feel pain anyway. Even people who don't have myeloma, if they're doing anything strenuous or overdo it or lift anything heavy, it is often the lower back that takes the toll. So maybe do upper body exercises. You can get these pedaling machines that you use your arms, and make sure that that's well toned, and maybe yoga or Tai Chi. I think Tai Chi actually, a lot of people look at Tai Chi and it looks very, very gentle, but it is all about balance. And if you're doing these balancing Tai Chi exercises, then you are toning your muscles at the same time. So perhaps try some Tai Chi or some gentle yoga in the first instance, and then get back perhaps to the water aerobics when things are improving. I think that's the best advice I can give you there, but maybe seek more specialist advice as well.
Okay, thanks very much, Ellen. Adrian, I hope that answered your question and that those examples are useful to you. I think that's all the questions we have time for today. If you have any additional questions or you just want to speak to someone about your current situation with myeloma, you can get in touch on the Myeloma info line. That number again is 0800 980 3332, or you can always email our specialist as well. The email address for that is askthenurse@myeloma.org.uk. We've got one more webinar that we'll be doing in the series, and we hope to see you again then. We'll be sending out the resources from this session very soon. Thanks again.